You're watching a production of South Dakota Public Broadcasting.
Welcome to Contours, conversations about issues in agriculture that impact us all. Contours is produced by the South Dakota State University College of Agriculture and Biological Sciences and SDSU Extension. These programs are distributed online through igrow.org.
Hello, this is Contours, as we continue to talk about important topics in agriculture in an open conversation with South Dakota's agriculture leaders and you. I'm Dr. Barry Dunn, Dean of the College of Agriculture and Biological Sciences here at SDSU. This is the second Contours episode where we explore issues and opportunities in animal health. In our first episode, we looked at animal health from the perspective of consumers. In this edition of Contours, we're going to focus on animal health and its importance to livestock producers. Healthy animals are an important factor in providing safe food. Just like people, animals can get sick and may require medicines to treat their conditions. More importantly, animal medicines are a critical link in the food safety chain as they represent a necessary tool for farmers and veterinarians to prevent diseases, treat sick animals, and control outbreaks amongst livestock and poultry. Modern livestock production involves a team of people committed to the animal's health with the goal of creating wholesome, high-quality food for consumers. Here are some of the challenges animal agriculture and livestock production face in terms of animal health. 2016 has seen a countdown to the implementation of the Veterinary Feed Directive, VFD, the new rule from the Food and Drug Administration that took effect last fall and will be phased in during December of 2016. Some changes having an effect now, but most of the changes won't take effect entirely until 2017. Outbreaks of deadly diseases in animals have made headlines over the past few years. The biggest headlines were reserved for the avian influenza flu outbreak that swept across the Midwest, including South Dakota. It had a devastating effect on chicken and turkey farms, some of which are still recovering. The reaction to such outbreaks highlights how producers and veterinarians work together, and that topic also highlights the importance of biosecurity in livestock production. The purpose of biosecurity is to establish a prevention barrier to disease-causing agents and other threats to livestock operations. It encompasses a variety of activities on the farm or ranch, including visitor and traffic management, the storage and handling of feed, employee training, and more. With that, we welcome back our animal health panel to look at these issues and others that are important to the livestock industry and consumers. These four people are intimately involved in animal health in South Dakota. Dustin Oedekoven is the state veterinarian for South Dakota. Dr. Russ Daly is professor at SDSU and SDSU Extension veterinarian and our state public health veterinarian. Dr. Kightlinger is the state epidemiologist for South Dakota. And Hannah Walkus is president of Pipestone Veterinary Services. Let's start by talking about antibiotics. The concern over this new FDA rule on the Veterinary Feed Directive, and then the broader issue of confusion and concern among consumers about antibiotics use in animal health and the food chain. Nationwide, there's an enormous discussion about antibiotics in food. There are meetings going on in Washington, D.C. Almost weekly about the new food directive for antibiotics. Dusty, walk us through what that change will be at the farm level and help us understand what farmers and ranchers will be coping with and the implementation of this important new directive.
Sure. Well, the veterinary feed directive is actually nothing new. It's been in place for almost 15 years, but it has not been very widely used by the livestock industry or really the drug manufacturers. And I think, here in recent years we've heard a lot about antimicrobial resistance, both in human and animal populations. The FDA has certainly been involved in discussions for decades about the problem of antimicrobial resistance in human populations, livestock populations, horticultural uses. We know that any use of antimicrobials in any population will contribute to resistance. So the FDA has determined that uses of antibiotics, especially those antibiotics that are important for human medicine, should be used in livestock populations only when necessary to treat livestock diseases for animal health. And so historically there were FDA label approvals to use antibiotics for growth promotion and for feed efficiency. One of the changes that we'll see at the end of this year is that those label claims on antibiotics will not be present. Those will be removed. So the only claims for use of antibiotics in feed, for livestock feed, will be for disease treatment, disease prevention, or disease control. And those are very closely related, but really separate reasons why you might use an antibiotic. The other change that will occur then is that those antibiotics will come under the veterinary feed directive use. Right now, most of those antimicrobials are available over the counter. And so, whereas now you can go to a feed store, for example, and purchase some of those antibiotics and feed according to label directions. And I'll note here that it's currently illegal to feed other than per the label directions. That's always been in place. So you have to go by the label directions, but it will change from over-the-counter to veterinary feed directive, which means that going forward, producers that are using antibiotics judiciously to treat or control or prevent diseases will need to meet with their veterinarian and get that authorization to continue to use those products.
Hannah, and I'll follow up with Russ, how do you see this playing out for the producers that the Pipestone system works with? Hannah, and then Russ on the farms across South Dakota with other species. So.
Yeah, no, that's a great question. And so Dusty did a very good job explaining what the changes will be coming forward. For us, it's just going to be a matter of formalizing and really increasing that relationship that producers have with their veterinarian. Because more of the products are going to be scripted and need veterinary oversight before the pig can even be treated or before the animal can even be treated, that relationship with the vet has to be at an all-time high. And that communication piece has to be done more frequently than what it has been in the past.
And think of our South Dakota cattle producers, it will mean some changes for them. They have been used to kind of adding feed-grade antibiotics to take care of their animals in the way that they have perceived is efficient for their own operation. But what will change for them is that veterinary involvement. And I talked to a guy just a couple weeks ago. He was very proud that he hadn't changed his ration for his cattle in over 20 years. Well, I can imagine some other things that probably changed in that 20 years. And what we're going to find is that kind of a producer is going to have an excuse or a reason to visit with that veterinarian. Veterinarian will be able to come in and say, this probably isn't the right time to be using this antibiotic. You're going to be better off for the animal's sake if you use it over here at this time or at this level. So I see some positives coming through with it. One of the issues is that, like Dr. Oedekoven said, there's no extra label use of feed-grade additives, and that means for different uses, for pink eye, foot rot, things that we might be using them for right now are going to now need a veterinarian to sign off on, and that's not going to be possible unless it's something that's just right on the label.
I might just add, Dr. Dunn, too, that, just to clarify, I really think there's a misperception out there that antibiotics are overused in livestock production. These drugs are not inexpensive, and And in controlling input costs into production agriculture, that is one of the things that's very closely monitored, and I think they're used very sparingly when needed now. However, as Dr. Daly mentioned, this will be a good time for producers to meet with veterinarians and find out if that is the right combination of drug that may be needed to treat that particular condition. And in some cases, that interaction with the veterinarian may lead to other management changes, may lead to changes in rations, potential changes in genetics. So there's a lot of possibility for improvement among the livestock industry with this change.
Yeah.
And I would echo Dusty's comments that producers don't use antibiotics just because they can. They, just like us, we don't take medicine when we're not sick because it's not good for us when we're not sick, and then also because it costs money. And so the use of antibiotics is only on an as-need basis currently. And overall, the use of antibiotics in animal agriculture has been decreasing as we've been more proactive at preventing diseases, utilizing herd health management plans with our veterinarians, utilizing vaccines so the pigs or the cattle don't necessarily get sick and need to be treated, and also just implementing biosecurity practices on our farms, which is anything that we do to be proactive to make sure that disease doesn't get in there.
So on a real pragmatic level, Hannah, help us understand what biosecurity looks like at a swine operation in South Dakota. What does that look like? How does that manifest itself in daily production systems?
Well, I like to say that the swine producers in South Dakota are the cleanest farmers you'll ever come across. And if you guys have ever been to a swine farm, it's because we implement shower in and shower out procedures. And that's not because you get dirty in the pig barn and you need to get clean when you come out. It's because we're concerned of the people bringing in diseases on their shoes or on their pants that will get our pigs sick. And so they actually have to completely shower and change clothes before going into the facility and then back out. We also make sure that the feed is coming from a secure location so it's not contaminated with diseases that we're then going to feed to those animals. And we also make sure then that any supplies coming in, such as boots or coveralls or anything that we need to take care of those animals, are also disinfected so they're not bringing in any risk of disease as well.
How does that look? What does that look like at a cattle operation, Russ, on a western South Dakota ranch?
Well, we don't have shower in, shower out facilities for most of those areas, but I tell you, people are understanding more about biosecurity all the time, and in particular in how we think about bringing new animals onto a farm. Animals bringing in new germs is probably as significant a way of bringing something new on as some of the other things when it comes to cattle producers. So we're seeing cattle producers think about isolating those animals in a separate area before they enter the rest of the herd, maybe doing some testing for diseases like BVD or trichomoniasis, depending on the animal before they enter the herd. And just thinking of all the different ways that diseases can come in, particularly through animals, but through other sources as well. For many of my producers historically, one of the things they'd like to do is to go to the sale barn and buy a new baby calf to put onto the mother who'd lost her calf. We know now that that's a bad idea. That's a way to bring in diseases that your animals haven't been exposed to before, and they don't have an immunity to them, and we can have some real disease outbreaks. So getting much smarter about that, even though we're not to the shower in, shower out area yet with our cattle producers.
We heard a lot about avian influenza last year and the porcine disease the year before. So I was pleased to learn about the monitoring of not only the poultry, but also the people that were involved in that outbreak. Dusty and Lon, tell us about how your agencies work together in that, and as this state dealt with a major outbreak of an animal disease.
Well, you mentioned the outbreak that occurred last year in 2015, and we did have 10 affected farms in South Dakota, 9 turkey farms and 1 layer farm. And the unfortunate thing that we saw with that particular strain of highly pathogenic avian influenza is that it very clearly affected concentrated farms. And so some of the efficiencies of production, which have led to the ability to produce safe, wholesome food very efficiently, also lead to the ability to, for viruses such as AI to transfer very rapidly. And as we've talked about before, even influenza is one of those diseases that can be a zoonotic disease, meaning it transfers from animals to people and back and forth. And so one of the things that we're primarily concerned with when responding to that is ensuring that our people that are responding to that particular outbreak are protected. We ensure that they are medically cleared to wear the respiratory protection that they're using, and that they wear that as they respond to those incidents. And we're fortunate, I'll let Dr. Kightlinger talk about it, but that particular strain that we dealt with in 2015 really did not become a zoonotic problem, but it was important that we worked with the health department to monitor our responders and the people on the farm that were around the birds that were affected.
Well, that's right. We didn't really know what kind of a virus and how it would play out, so we wanted to be very watchful and very cautious. So people that were working with the dead birds or helping in the depopulation, they were self-monitored for 10 days after their last touching of the birds or their feces or anything like that. And what we were looking for is people spiking a temperature or having respiratory symptoms. And then we were set up to test them right away to see if they had contracted that virus, because we're always afraid that people are going to be infected and then the virus is going to have the ability to be transmitted person to person, and that would kick off a whole new influenza pandemic strain.
And I might add that we just have not seen that in recent history in the United States, which is very fortunate, but also a testament, I think, to the monitoring and the response that we have towards some of these strains of influenza. Worldwide, we certainly see influenza viruses easily transfer among different species, including humans, and cause, in some cases, deadly outbreaks. And we're seeing that, we have seen that in recent years in other countries.
Yeah, every week we get notices of this bird to human transmission in places like China or Egypt or Nigeria or such. And you got to remember, people live a lot closer to their animals there. You may have your chicken house is right next to your kitchen, or you go to the live chicken market and you say, I want that bird, you take it home, you kill it. Well, very few people in the United States do that now. So it's just a different situation, habitat for these animals and for people. So we have not seen that transmission here in the United States. But even so, we're watching for it.
Yeah, I might switch a little bit to the topic of vaccinations and their use in food animal production. Certainly a controversial topic in our society, as it seems like the more sophisticated we got, maybe maybe there was some pushback on some of these proven techniques to help us all in terms of health. And so we hear a lot about vaccinations on the human side. Help us understand, I mean, maybe I'll start with you, Dr. Daly. What's the vaccination protocol for food animal production? Are vaccines used, are they a key part of that production system?
Yeah, they sure are. What we're finding is that every food animal system, every species has their own set of diseases that we try to boost their immunity to. And just like taking our children to the clinic to get their vaccines before they enter school and bigger populations of animals, a lot of times, people in their case, our efforts are focused on helping our young animals get a good start to their life as far as the immune system goes. So with cattle, it will be something like giving them vaccines against the common respiratory viruses that they're going to be encountering as they move, go away from their mother and enter large feeding operations and become bulls and cows someday. We want to get those animals kind of primed at a young age. Same would go with the swine populations, sheep populations, dairy calf populations. Every one of them has their own vaccines and their own diseases. there's a lot of different choices out there for these. It's not as simple as going to the doctor or the human clinic and here's what you need and here you have it. We have all sorts of different brands of vaccines, different combinations. And what we're finding is the role of a veterinarian, even though the companies are very involved with these vaccines, the role of veterinarians become more important in helping producers sort out not only which vaccines to use, but when to give them. Vaccines are a very important part of helping those animals withstand those diseases that they're going to be encountering someday.
Yeah. And not only from a production standpoint, which is a very crucial part of production, as you mentioned, but vaccinology is an exciting field for food safety as well. For example, we hear about E. coli being a concern for food safety, and we know that cattle, for example, can carry E. coli without experiencing any problems. And during the harvest process, everything that is done to limit that, bringing E. coli from the cattle to the final product of beef, there's a very complex process there of cleanliness and sanitation. Even so, sometimes, unfortunately, some of that E. coli gets into that final product. And we know through the use of vaccines, we can potentially reduce that threat of E. coli further. So there are a lot of exciting things on the front of food safety.
Agreed.
Hannah, you hear about booster shots for on the human side. Do the herds you work with, do you regularly give booster shots and vaccines for the sow herds that you work with?
It depends on the vaccine, and some of the vaccines they do not require a booster. They have lifelong immunity to them, so we don't necessarily need to do that. But then a lot of for the maternal populations, a lot of those do require a booster, and so they'll get a booster shot a few weeks before they give birth to litters, so they can not only protect themselves but also pass on some immunity to their babies.
One of the things that I noticed in the discussion about animal disease, and I'd asked Lon to pick up on this, seems like when we don't understand something real well or it's unclear, we kind of look for a scapegoat. And in some of these discussions, Lon, we've looked to the wildlife population, but some of that's real, isn't it? I mean, this isn't just about food animal production or humans. There's a wildlife population that migrates back and forth that does play a role in the challenges we face. Can you expound on that a little bit?
Well, yes, there are. And some of the big, as Dustin mentioned, E. coli outbreaks, the gastrointestinal diarrheal disease, has stemmed from wild animals coming into like spinach fields in California and then contaminating those. Here in South Dakota, we've got what we call rabbit fever or tularemia. We had a big year for that last year. We had 25 human cases. That's a disease that has been deadly in South Dakota, and it can make people very, very, very sick. And we found it's typically in rabbits or prairie dogs or gophers, but it also cats when they're out hunting. And we've had several incidents in South Dakota where a pet cat has tularemia and then spreads it to their owner. And the classic has already been mentioned, rabies. It's reservoired in the skunk. The wild skunks can be spread to unvaccinated dogs and cats and cattle. We haven't had a human rabies case in South Dakota since 1970, but we work very diligently to prevent that.
So as a farmer, rancher, producer in South Dakota works with these issues, help us, maybe I'll ask you, Russ, to help us understand the record keeping that a producer has to go through to help communicate to the public, but also to his veterinarian, what's going on a ranch or farm. What do those records look like?
Yeah, we've seen a big increase in the ease of people being able to keep production records. So at this very basic level, it might be treatment. What do what animal did we give a medication to because of which disease? And as I'm sure Hannah can speak to, the progressive operations are starting to use those, not just at the end of the year to say this is how many animals we treated, but to look at patterns in illness. You know, when do our animals get sick? What's effective treatment for them, and how to proactively prevent that from happening in the future. So, you know, depending on which kind of operation, you'll see a varying amount of production records, but the trend has been that people keep more of those records and use them in a better fashion.
Correct. It all comes down to knowledge is power. And so many of our progressive producers that we work with want as much knowledge as they can get so they can be proactive and try to mitigate some of the health challenges that they have because they're able to get ahead of it, taking the information or the records that they have from previous animals.
So we hear about withdrawals. So what's a withdrawal, and then Hannah, how do you manage it on the farm?
No, that's a great question. That is kind of a hot topic in the industry. A withdrawal is the time that it takes an antibiotic to exit the meat and not be detectable in the meat at all. And so how we manage that is when an antibiotic is made, it has to go through an approval process through the federal government, through the FDA, and they assign a timeline to that it takes from the time they give that medicine to the time that it exits. And when producers give those antibiotics to the animals, they have to individually mark those animals so they can pick them out of the group, and then they have to document when they gave that antibiotic and make sure that that animal does not go to market before that time has elapsed. And there's also testing procedures at the plant level, at the harvest level, to test the meat to make sure that there is no antibiotic residue that surpass the system somehow.
So, Dusty, just wrapping it up, how do you feel your confidence in the food animal system? What reassurance or can you give consumers about the food supply and related to antibiotics and some of these disease issues?
Well, I think we've seen a lot of adherence to programs like the pork quality assurance and the beef quality assurance programs, which integrate some of these record-keeping programs. And in addition, I think we have the metrics on the harvest side to indicate that residue issues have really been in decline. There's the National Antimicrobial Residue Monitoring System, which is a partnership between multiple government agencies, and those trends typically are showing that producers are doing a good job of adhering to withdrawal timelines, and that we do not have antimicrobial resistance issues in our food product.
We hope this has informed and reassured you about some key issues in animal health. If you'd like to learn more, check out our iGrow website, igrow.org, and click on the livestock section. We've also set up some links on our website that will connect you to more information from the State Veterinarian and the South Dakota Department of Agriculture. I'd like to thank our guests today for providing insight, information, and inspiration. Thanks to Dusty Oedekoven, Dr. Russ Daly, Dr. Lon Kightlinger, and Hannah Wakas. That's all the time we have for this edition of Contours and our discussion of animal health and livestock production. I'm Dr. Barry Dunn. Thanks for joining us. We hope to see you again for the next edition of Contours.
Contours is a conversation about issues in agriculture that impact us all. These programs are produced by the South Dakota State University College of Agriculture and Biological Sciences and SDSU Extension. You can watch these programs on your local South Dakota Public Broadcasting station or by going online to igrow.org.